Was so absolutely sick.
He was really what we would consider a pre-terminal patient.
It's very scary. This is, it's your only father. We were all fearful.
It was indeed a life-threatening problem. And so I actually said goodbye to him over the phone. Too many patients that get cancer, the only thing that ever happens to them is people are giving them remedies for the cancer. Nobody is ever saying, well, what about his immune system? Which is a complete mistake. They're missing a lot of things that can help people.
I just had a feeling that somehow that things were going to get better.
Welcome to The Incurables. I'm Don Wildman. Robert Shaw had led what by all accounts would be considered a charmed life. He was a cherished husband and father, a successful businessman, and a well-respected member of the community. Then Robert's doctor told him he had a terminal condition and suggested he get his affairs in order. But Robert wasn't about to accept that. He was a man of faith, so when doctors told him they could not help, he didn't panic. He did what he'd always done. He gathered together his beloved family and told them he had a plan. It may not have been the path most would have taken, but Robert had the courage to do whatever it took to beat the prognosis.
I went to a local doctor here who said, you've got cancer in the prostate.
You normally tell guys that age, we won't do anything. We'll just kind of sit and watch this and see if and when this becomes a problem.
Pure fear took over, no question about it.
The doctors seemed to think that he wasn't going to be around much longer.
Fear is present, there's no question, there is fear.
Nobody wants to see their dad possibly go.
Watching him suffer, that was terrible.
You get the cold chills day after day for a while till you find you get adjusted to this strange thing is happening to you. I had always had the attitude that Norman Kasdan says, who wrote Anatomy and Illness, defy the verdict.
Robert has always been comfortable in his own skin. His tendency toward self-reliance and his positive outlook on life are rooted in his small-town Pennsylvania upbringing.
I went to a little country high school of about 400 people from the 7th grade through the 12th grade. My childhood was mainly one in an agriculture community, a lot of woods and fields and streams around where we went fishing, swimming in the old-fashioned swimming holes you see in movies.
Like many of his generation, Robert answered the call of duty just out of high school. He joined the Navy's aviation program and entered the reserves. After completing the naval education program, he was stationed in Corpus Christi, Texas, where his pursuit of knowledge continued.
After World War II, I went back, as millions of us did, under the GI Bill to Penn State to finish up and graduated around 1948. And then I taught high school for about 8 or 9 years.
It was while in college that Bob found Christine, the woman he would marry.
Well, we met back at the University of Delaware. I was vocalist for our college dance band at the time.
Some nice professor's wife arranged a blind date, and they had a dance prepared one evening. So I went there to the girls' dormitory, and here came this little blonde girl down the stairs. Little did I realize that she sent down 2 girls to spy me out to see what I looked like. And I apparently passed muster because she came down and we went to the dance.
And we hit it off right away.
Having taught high school math for 9 years, I finally got a little disenchanted with the modern bureaucratic school system, so a very fine man encountered me one day and brought me into the life insurance business. He started me on a new career as a life insurance agent, where I stayed in for the next 45, almost 50 years, and in which I am still somewhat involved taking care of my clients. But it's been a very gratifying business, being able to help people all these years and help bring them to some financial security they would not otherwise have had. So it's been like a missionary enterprise for me.
A friend of mine and I were walking through a big craft fair, and my friend happened to look up and see my dad sitting there on a brick wall. And my friend pointed it out that he said, "That's your dad, man. He doesn't look that good." And I remember looking over and just something wasn't right. He tried to keep the same smile that he usually has on his face on there, but it just really wasn't working that day.
I was having a little problem swelling in the urinary tract. I had to get up and urinate maybe 8 or 10 or 15 times, getting many, many sleepless nights. And finally a burning, paining sensation occurred in there. I began to realize I'm going to have to see a urologist here in town.
The tests confirmed Robert's worst fears. A healthy prostate releases antigens at levels below 4 nanograms per milliliter. His PSA levels were dangerously higher. His doctor was more than worried, and Robert will never forget the urologist's grim advice.
He said, "You should really go home and make out your will, Bob, because there's nothing we really do for this type of cancer that you have."
It just didn't seem real. Nobody thinks anything can happen to them. It's always the other person down the street. My mom was a wreck, and so we all tried to be there for her.
I said, "Now, guys, we're going to have to trust the Lord for this, to work this thing out. We're going to live with this and so on, do what we can day by day."
I know he hurt me, even though he didn't complain. I knew he was in agony.
Doctors held little hope for Robert's survival of the painful disease that had invaded his prostate. They performed a procedure to make him more comfortable, but it wouldn't cure the cancer. His family prepared for what they expected would be his last days.
My brothers and sisters all seemed to take it very differently. My brother was absolutely wonderful. He was right down to the medical library and just on the internet and trying to find out everything that he possibly could. My sister, she was just very skeptical, thinking that this is his time to go. And my other sister was right in there with my brother and very much supportive to my mother. We were all fearful, but she seemed to be pretty positive, my oldest sister.
Bob and I often prayed together. I think that's very important.
And then, I believe as an answer to prayer, a friend of mine here in town was also an insurance agent, told me that there was a place in Reno where they had homeopathic treatments for prostate cancer.
Robert had no intention of sitting around the house waiting for this killer to destroy his body. He was willing to explore all methods of treatment, which led him to Reno.
Robert Shaw, a patient of mine with advanced prostate cancer, stage D, was treated primarily with alternative complementary therapies. And one of the first modalities used was Laetrile. It's a product that comes from the pits of peaches and apricots and cherry pits, and it's a benzaldehyde compound that has a cyanide molecule in it, and it blocks the fermentation enzymes of the cancer cell.
I was a little bit fearful when I found out my dad was not going to choose the normal chemotherapy route or radiation route of treatment for cancer. We tried to be open-minded on it, but it's very scary. This is, it's your only father. I'm just thinking, gosh, I really hope he knows what he's in for here.
He was given a regimen of intravenous Laetrile once or twice a week for a number of months, and this brought his PSA back to normal levels.
What a PSA test would show was a standard prostate, no more evidence of cancer.
The progress was encouraging, but his new doctors were well aware that Robert was not totally in the clear. The alternative treatment would continue in an attempt to hold the cancer at bay.
So when Bob came to see me, he probably didn't know what the heck he was getting into. Most of my patients do not. And so I spend a lot of the time just kind of educating him about, what this is all about. What is this alternative medicine thing? So I put him on an exercise program. I said, look, I want you to eat this way. I think there's a few loose ends in your diet. Here's some supplements, here's some herbs, here's some homeopathics. I want to take you to take these.
Homeopathy is a centuries-old controversial practice that originated in Europe. It was a time when what we now consider traditional medicine was struggling to find its footing. The basic principle of homeopathy is to treat not only a specific disease, but its disruption of a patient's overall life force. This is done primarily by administering small doses of substances that cause the body to mimic symptoms of that disease.
It's usually a naturally occurring substance, and what we do in homeopathy is we dilute it out infinitesimally.
In general, homeopaths believe that the body has a unique ability to heal itself from within. Critics contend that any perceived benefits are all in the patient's mind. While positive thinking definitely has a place in homeopathy, practitioners argue that it's much more than that.
The other thing that a lot of people don't realize is that the term homeopathy also refers to, how you eat, how you live your life. So all these things become factors too. And so when I use that term, I'm referring to, lifestyle issues, dietary issues, nutritional issues, right on down to even hormonal issues.
The regimen that Robert followed allowed him to not only put his prostate cancer into remission, it gave him the opportunity to return to a normal life without any of the debilitating side effects often caused by radiation and chemotherapy.
It's important to remember he had no radical surgery, he had no radiation therapy in all of its forms, nor was he on any hormonal therapy or chemotherapy. Now, going 10 years with stage D prostate cancer on just complementary therapy alone, in many ways, is an extremely successful event.
And I was feeling good up until about 1997. And then all hell broke loose.
Shaw's battle with cancer was not supposed to last very long. Yet he not only survived 10 years longer than doctors said he would, he thrived. He earned himself an extra decade with his family because he was willing to trust his instincts and the doctors who offered a more holistic alternative. But now it seemed that Robert's time may have run out.
It was a Halloween night, and suddenly I was having terrible trouble breathing. I could hardly breathe. I was gasping for air.
I was staying here at my folks' house. I've been a musician my whole life and was playing in Reno at a casino. Got home late and woke up to the trample of a bunch of feet coming through the house, which were paramedics.
Went to the local hospital here immediately, and of course, they gave me oxygen right away and checked my heart. And while I was in there, they did a thoracentesis. It's where they drill a hole in your back between your ribs and drain out equivalent of almost a half-gallon of fluid. Black, dark brown stuff looks like chocolate milk coming out of the inside of all around your lungs. That's why I couldn't breathe.
Sometimes what happens with cancers is mutant cells develop that are resistant to the present therapy program, and they become much more aggressive and malignant. And this is what happened with Bob. He developed metastases around his heart and around the surfaces of his lungs. These metastases, or daughter cells as we call them, created fluid in the lung cavities and around the heart chamber, or the pericardial sac.
And they finally said, we'll let you go home now because, they told my wife and me both that, you got to realize, Bob, this is a terminal situation.
He was really what we would consider a pre-terminal patient. He had to be hospitalized at our local major hospital, which at that time was called Washoe Medical Center.
I was in Washoe Medical Center for about a month. I had IVs in my arm, and I had out everywhere his tubes were coming out of me.
I gave Dr. Forsythe the call and said, what's going on with him? And Dr. Forsythe said, he's got extremely unusual condition. And it looked like he was going to die in 12 hours. I actually said goodbye to him over the phone.
Strange as it may seem, it was not awfully disconcerting as it was the first time, because I realized at that time I'm 70 years of age, and I realized that we're all going to die sometime, and maybe this is my time.
I don't think my dad was ever, to my knowledge, even afraid of having cancer. I've never seen a guy as faithful as he is with his belief in God. He's just one of these guys that seems to think that no matter what, he's here as an example to other people, and nothing seems to really bother him.
I had the Bible there. I was reading the Bible continually, and then after my Bible reading and thinking, and I just had a feeling that things are going to get better.
It's so remarkable that the Dr. Forsythe, because he's a licensed oncologist, he works in hospitals. So he was able to go in the hospital, initiate some initial therapy.
I was called in and treating him, his blood clots, with anticoagulant solutions such as heparin and Coumadin. And then we treated him for his infection at the time. We treated his kidney failure, and we put him through rehab as well because he was extremely debilitated and weak. But I wanted to get him to an outpatient status so that I could begin my complementary therapy in full force.
So I got to the point, Dr. Forsythe said, it's almost New Year's. I said, I'd love to go home, Doc, if I'm well enough. He said, I'm going to let you go home. So New Year's Eve, big light shine on in my room, and here I am on the way home to Carson City to my old house on Long Street.
Robert's return home was obviously a welcome development, but there was plenty of work left to do.
One of the complementary treatment modalities we used at that time is what is called phyto, coming from the word plant, and estrogens means plant-based estrogens. This group of estrogens, which were entirely derived from plant-based sources, were very effective in bringing Bob back into a good remission without having to give him hormone shots, which is a more conventional modality of therapy. I did not feel that he needed to go into chemotherapy, which is usually used primarily when the disease becomes independent of hormonal control, or what we call refractory disease.
Dr. Forsythe put Robert back on the Laetrile treatment that had proved so successful in the early stages of their work together. Unfortunately, these treatments were administered several times a week, and Robert was forced to travel nearly 100 miles round trip to receive them. This is no easy task for a 70-year-old with 10 years of cancer behind him. So Dr. Forsythe agreed to turn over Robert's care to his colleague in Carson City, which was much closer to Robert's home.
I felt it would be beneficial to him to have another, what we call alternative doctor, another homeopath, who's in the Carson City area, who was willing to treat Bob with my protocols using the Laetrile treatment protocol. And that worked out very nicely for Bob. It saved him a lot of travel time and expense.
The thing was with Bob, he had such a serious life-threatening condition and was so absolutely sick. And what I had to explain to him was, Bob, this is a chronic condition you have. It's not going to go away. Stage 4 cancer, you more or less, you got to think you always have it. Ultimately, we got him to the point that it looked like we really had, we were going to be very successful with him. And so at that point, we kind of start tapering off the therapies.
Bob came through the therapies very well. His PSA again returned to normal level of 0 to 4, and he went into a complete remission, which he stayed in until he developed refractory disease.
The difficulty in fighting a cancer as advanced as Robert's is that the disease is never actually beaten. It just seems to manifest itself in difficult and more deadly ways.
A little over a year ago, my PSA went up. PSAs have a way of going up and downs in some people. And in my case, about a year ago, my PSA shot up to a little over 400. Being in constant touch with Dr. Forsythe, because he does periodic tests on me, he said, let's get you on Taxotere because we find we're using it now to help pull PSAs down and for other types of cancer treatments.
We told Bob at this point, your disease is independent of all hormones and we have to use low-dose chemotherapy. We chose a drug which is a conventional drug called Taxotere, and it is a very effective drug in the low-dose form, and I have always used it that way. Now, you can use it in the high-dose form, which is given every 3 weeks, but that's much harder on the body and the immune system. It's much harder on the nervous system, much harder on the blood counts.
My PSA descended from 400, over 400, all the way down to way under 4. It was down to about 1.5 not long ago, about a month or so ago. So we're very delighted. My health and vitality are normal.
Bob has gone into a complete remission, but we have not stopped complementary therapy. We're giving that right along with the low-dose chemotherapy. And we feel that he's getting the best of both worlds.
Robert never actually intended to completely reject traditional Western medicine. It's just that his previous doctors gave him very little hope of survival.
I never told my local allopathic doctor that I was going for this alternative treatment because I had a feeling that the doctors who are strictly allopathic, they have a way of looking at medicine and from their training and experience. And I knew they had some of them had an abhorrence or a disdain for alternative medicine, so why would I bring it up to them? I just quietly go and did it.
These days, my dad seems to be doing much better. Watched him considerably grow in every way, shape, and form mentally. He's back in the gym all the time. He's always throwing bad jokes at me. I worry about him. You know, it's very hard. Nobody wants to see their folks get older. He's 81 years old now, and that's the hardest thing in the world. But overall, health-wise, he's doing fantastically.
Life is good. I'm back to doing a lot of reading, trying to develop a little short story writing hobby. I'm very active in our church and Bible study groups. We have some prayer groups in church, and praying for other people.
Bob's an optimist all the way through. You couldn't meet a more wonderful person in your life. And I truly mean that. He tells me he loves me every day of my life.
There's a lot more information out there, and I happen to know from experience, there's a whole field, a branch of medicine that your local doctors do not participate in.
There are things that we do here that aren't done in conventional medicine, and every now and then we see somebody get a remarkable result that you would never see with conventional medicine because the two added together work so well.
When Robert Shaw was diagnosed with late-stage cancer, he wasn't about to throw himself on the mercy of conventional doctors. So he gathered his inner circle together and told them he had decided to look beyond what standard medicine had to offer. It was a decision that ultimately saved his life.